Last fall, HRSA clarified that civil legal aid services constitute enabling services under Title 330. Can you talk briefly about that change, the rationale behind it, and what it might mean for the health center field?
Great, so that's a great question. You know, it's really, as you stated, more of a clarification than anything. It was always a part of the enabling services that are part of our Section 330 Public Health Service Act authorizing legislation for the health center program, with the recognition the health center mission is really to not only improve access to care, but high quality services. And we know with the underserved populations and vulnerable communities we serve that there are a multitude of barriers, and these enabling services are so important to mitigate those barriers and help people not only access care, but continue to be engaged in care. So we clarified that actually civil legal aid is in fact a very important enabling service. So what does this mean to health centers that we've clarified that this is part of the scope of services? Well, essentially you can use your grant funding now and any program income to support developing partnerships, maintaining medical legal partnerships in health centers. The other benefit of this is we've recently been providing a lot of rewards around quality improvement, really to that second part of the mission to assure high quality care for the patients that we serve. And we've put out quality improvement awards, base adjustments, we put out resources for patients in a medical home, and they haven't had a tied, you have to do this, that, or the other. It's really just to go back to improve quality of care. And we believe using those resources to develop medical legal partnerships, support enabling services, are a critically important opportunity. And then last, I would leave with, we're doing an expanded service opportunity coming up soon, and one of the areas that we've looked at is really carving out a portion of that for enabling services, one of which is medical legal partnerships. So there are resources out there to help health centers to do this work.
Thank you.
Great, thank you. So next question for Suma. We're going to a couple of questions for each of the speakers, and then we're going to open it up. So at the National Center, as you know, we focus on bridging between the health and legal communities. Can you talk about how you see legal aid partners operating in the health center setting? Is it analogous to behavioral health, for example? And if so, what does that look like? And then I have a follow-up.
Okay, great. And you know, one other part that I meant to mention in the previous question, so not only is it now clarified that it's enabling service, so what is the reason, in addition to now that they know that health centers can use their grant funds to this, why would they do that? And I think it's really important as a part of our overall vision around high quality care and delivery system transformation. As you know, the Affordable Care Act focused not only on insurance reform, that was a big part, but the second really important part we've been focusing on as a department is delivery system reform. Really making sure we really think about the way we pay for care, the way we deliver care, and that we share information so it's improving health and wellness. And medical legal partnerships are so important in that move from volume to value. It's really an important value proposition or part of that value equation for health centers now that they're responsible for their patients, and not so much we're counting all of the little interventions, but we're counting, are they any better off? Enabling services are critically to get to that outcome piece. So it's a critical part of our overall system transformation efforts as well. So your question around integration. We talked about the importance of integration and coordination of care within the health center program, so a comprehensive set of services. We've been working toward these ends on behavioral health integration, oral health integration, and now these really critically important enabling services. So in the behavioral health context, they've looked at it as a continuum of integration from you really are not that coordinated that you know there's someone down the street you can put a referral to all the way to the other end of the spectrum, full integration where you're sharing an EMR, sharing files, sharing systems, and you truly work as a team. And I think medical legal partnerships can function that very same way. Some of the early case studies we've seen, you've had just the referrals all the way to where you get full integration and that they're there and they're part of the care team. You know, the end ideal state is really where both the clinical providers and the legal service aid providers are working together as a team proactively and learning from each other and increasing each other's capacity in their respective areas to truly improve not only individual health, but population health. And so I think that's where we see that going, which is why we're really excited to have our partnership with the National Center to provide, now that the resources are there for health centers, really to provide that support and best practices around how you integrate given your context and the patients that you serve.